high blood pressure, hypertension, and risk factors causing it. What is hypertension? Hypertension, also known as high blood pressure, is a long-term medical condition where the blood pressure in the arteries is persistently elevated. It is a common condition that can lead to serious health problems if left untreated. It's often called a silent killer because it may not cause noticeable symptoms. Yet it significantly increases the risk of heart disease, stroke, and other serious health problems. The condition is diagnosed when blood pressure readings are consistently at or above 130 by 80 mm mercury. It's important to understand that blood pressure fluctuates throughout the day. So a single high reading doesn't necessarily mean a person has hypertension. A diagnosis is typically made based on the average of multiple readings, taken on separate occasions. What are the risk factors leading to hypertension? Hypertension, or high blood pressure, is a common condition with several risk factors. These risk factors are divided into two groups. Modifiable risk factors. Modifiable risk factors are those that an individual can take steps to change. Non-modifiable risk factors. Non-modifiable factors are those that cannot be altered, such as age, family history, and race. Let's discuss them in details. Modifiable risk factors. Modifiable risk factors for hypertension are lifestyle choices and conditions that can be changed to reduce the likelihood of developing high blood pressure. By making changes in these areas, individuals can significantly lower their risk of hypertension. Following are examples of modifiable risk factors for hypertension. Diet. Diets high in sodium and saturated fats can contribute to hypertension. Reducing sodium intake, increasing potassium intake, and consuming a balanced diet rich in fruits and vegetables can help lower blood pressure. Physical activity. Lack of physical activity is a significant risk factor. Engaging in regular exercise, even moderate intensity, can significantly reduce the risk of hypertension. Alcohol consumption. Excessive alcohol consumption is linked to elevated blood pressure. Limiting alcohol intake, or abstaining altogether, can help lower blood pressure. Smoking. Smoking damages blood vessels and increases the risk of hypertension. Quitting smoking is crucial for reducing the risk. Weight management. Being overweight or obese increases the risk of hypertension. Maintaining a healthy weight through diet and exercise can help lower blood pressure. Now we will discuss the non-modifiable risk factors of hypertension. Non-modifiable risk factors for hypertension are characteristics or conditions that a person cannot change, and that increase their risk of developing high blood pressure. Following are examples of non-modifiable risk factors for hypertension. Age. As people get older, their blood vessels tend to lose elasticity, which can lead to increased blood pressure. Family history. Having a close relative with hypertension increases your risk of developing it as well. Genetics. Certain genes can make individuals more susceptible to hypertension. Race or ethnicity. Some racial and ethnic groups, like African Americans, have a higher prevalence of hypertension.